Last week at the American College of Cardiology meeting, my colleagues and I presented some new work that we have done on alternative access for transcatheter aortic valve replacement. As most of you know, we can now replace the aortic valve, which sits on top of the heart and keeps the blood moving in one direction when your heart pumps the blood to the rest of your body, with catheter-based techniques, obviating the need for major open heart surgery and the sometimes complicated recovery that accompanies that surgery. We can now replace the valve with transcatheter techniques, and the patients can go home on the very next day. In order to be able to accomplish this procedure safely, we have to have arteries in the groin that are of sufficient size to be able to accommodate the prosthesis, which is about the size of my little finger. If patients have blockage in these arteries, we can't use that access route for placement of the valve, and we have to think about a different way to do it. One of the most popular ways that we have come up with is to replace the valve using the artery in the neck called the carotid artery, which carries blood to the brain. In order to be able to do this safely, we have to try to minimize the risk of stroke. And one of the ways that we have done that is by using some technology that was originally made for carotid endarterectomy, or for treating blockage in the neck, and using it to be able to reverse the flow of the blood in that artery to allow safe placement of the prosthesis. It has been one of our preferred access routes for alternative access, and we wanted to let everybody know about it at the conference. One of the most provocative talks at the American College of Cardiology meeting was done by Dr. Mike Reardon and involved durability of heart valves. As you know, we want to try to place one heart valve in this patient and have that heart valve last the rest of their life. But unfortunately, the tissue valves that we place sometimes undergo structural degeneration. And Dr. Reardon presented some very interesting work which compared transcatheter aortic valves to regular surgical aortic valves that are placed the conventional way, and found that a certain type of valve prosthesis made by Medtronic Corporation lasts a little bit longer than surgical valves if the patients are matched for all of their comorbidities. This is remarkable information because one of the most important things that patients should consider when talking to their doctors about aortic valve replacement is durability. We don't want them to ever have to have another operation. So in order to be able to provide the most durable result, there have been a number of things or factors that have to be considered and have been identified as important factors. One of them is the age of the patient. Valves don't last as long in younger patients, and this has implications for lifetime management of these patients, as you can imagine. But also the fact that the larger the valve placed, the less likely the valve is to undergo structural degeneration. And there are a lot of factors that go into determining which valve is appropriate for which patient. We were also part of a panel discussion on shared decision making, which is trying to get patients and doctors of all different types to get together to try to understand what the best mode of therapy is for each individual patient and to involve the patients in this decision. We think this is eminently important, especially when we're talking about lifetime management of patients.